Hi, my name is Dr. Alan Cross. I'm a board-certified chiropractic physician. I've been practicing in Tucson for 15 years. If you suffer with chronic conditions, fibromyalgia, migraine headaches, spinal stenosis, peripheral neuropathy, then we've got some great news for you. We have a program where we attack your problem both from the neurologic sense and the metabolic sense. And we get really great results with that, and I'm here to share with you some information today. So, what makes us different from every other doctor you've seen? Because we do attack metabolically, neurologically. We leave no stone unturned to find the exact cause of your condition. How do I successfully treat fibromyalgia, migraine headaches, peripheral neuropathy, spinal stenosis? By using specific metabolic and neurological testing and treatments. We obtain a thyroid panel on you, a complete metabolic panel, a lipid panel, and a complete CBC. Now, you may have had some of these tests done before, but oftentimes they're done in a limited basis. The doctors know that the insurance companies squawk if they order too extensive tests, so they usually just order the bare minimums. Well, we're going to leave no stone unturned. We want to find out the exact cause of what's going on inside your body. And oftentimes, if you've had the lab test, they may say everything looks normal, but they're looking at things in the lab range where we're looking at things in the functional range. Here's your lab range, here's your functional range. We want to get you to where your body's working optimally. We do sensitivity training to find out if you're sensitive to glutens, wheat, rye, oats, barley, milk, eggs, yeast, and soy. If you have sensitivity to this and you're eating these foods, your body is just not going to be operating the way it should be. So we need to find out if you're sensitive to that, and if it is, you may need to eliminate it for the rest of your life, or at least until you can get your body back to where it's operating normally. Here are some of the symptoms of these sensitivities: chronic pain or fatigue, frequent indigestion, if you're bloated after eating, frequent loose bowel movements, constipation, mouth ulcers and sores, or if you vomit often. We also check your adrenal stress index. Everybody with their life today, as busy as they are, everybody gets stressed. Your adrenal glands help you handle stress. And if you've been under stress for a long time, then your adrenals are going to get run down. They're not going to be able to fight stress the way that they should be. If you suffer from insomnia or blood sugar issues, this test will measure your cortisol levels. We check your immune panels. Your condition could be caused by an autoimmune disorder. Autoimmune means that your immune system is attacking your nervous system. And if that's the case, we need to take care of that first. That's first priority right there. Because if we don't get that under control, you're never going to get back to the health that you should enjoy. We're going to determine if you have an active antigen or dysregulation. Antigens such as parasites, bacteria, virus, mold, yeast, fungi, foods, chemicals. If you've got an active antigen, a bug in your bloodstream or in your GI tract, then we need to find out what that is and take care of that for you. We use a saliva test, a breath test to check for H. pylori to see if you have any problem related to gut function. We test your intestinal permeability. If your intestinal tract is letting things leak out of it that shouldn't leak out of it because the membrane's a little it's letting things out that shouldn't. Okay, it's just kind of too permeable. Then we need to address that issue also for you. It's called leaky gut syndrome. We check your neurotransmitters, your hormone panels. Check for inflammation. If you've got an inflammatory process going on in your body, then that's going to be a whole nother problem that it can cause you problems with your joints, all those kinds of things. So we need to check that out for you too. We use glutathione in our office. It's a cream. Glutathione is the most powerful antioxidant there is. Can help with all kinds of conditions. It's one of the first things we get folks doing is using glutathione. Use oxygen therapy. Oxygen is fuel for your brain. Your brain needs two things. It needs fuel and stimulation. And the fuel is in the form of oxygen and glucose. We have a medical doctor we work with who gives us a prescription for the oxygen that we use in the office. And almost everybody who comes in my office is going to be on oxygen therapy. And because with our lousy atmosphere, pollution, everything like that, a lot of people are just not getting the oxygen supply to their brain nervous system that they should be. So we get folks on oxygen. Brain-based therapy, we use lots of things for this. The brain-based therapy is, as again, I told you at the beginning, we're attacking things both neurologically, metabolically. We got done with the metabolic part, talking about the blood work and all that stuff. Now the brain-based therapy is attacking things neurologically. We're going to use things to stimulate whatever parts of the brain might not be working properly. Vibration therapy, laser therapy, spinal decompression, interactive metronome. So there are a lot of things we do to try and stimulate your brain on that end, as well as giving it the oxygen and the fuel that your brain and nervous system needs. So ask yourself the following questions. How has your chronic condition affected your job, relationships, finances, family, other activities? What does it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? And what is it worth to you if we could improve your condition? I'm offering you 2 free visits to see if you're a candidate for care in my office. Not everybody is a candidate, but that's why we give you the 2 free visits to find out. I don't want to charge you to find out if I can help you. Okay? This offer is good for a short time. I don't accept all cases, only those that I really feel that I can help. I don't want to take anybody's money and not have them feel like they got more than their money's worth out of the care that they got in my office. Looking for patients that are warriors. They'll do whatever it takes to get themselves better. If you'd like to schedule your 2 free visits, please give me a call at this number. Speak with my staff. Some of the chronic conditions that we can work with are rheumatoid arthritis, Sjogren's syndrome, lupus, scleroderma, the whole list of items there. So in conclusion, if you have any of these conditions, if you are tired of the chronic pain, whether it's fibromyalgia, again, the migraine headaches, peripheral neuropathy, spinal stenosis, give me a call. Let's see if we can take a look at you, and if you're a candidate for care in my office. Again, not everybody is, but I give you 2 free visits to find out, so there's no cost to you. So give us a call. We'll get you scheduled and see if we can help you out. Thanks a lot. Have a great day.